Why is mesothelioma less known than other lung cancers? Imagine hearing about lung cancer and immediately thinking of smoking or big tobacco campaigns. But mesothelioma, a rare type of cancer affecting the lining of organs, especially the lungs, doesn't get the same attention. This is mainly because mesothelioma is much less common than other lung cancers. While lung cancer is one of the most diagnosed cancers worldwide, with over 200,000 cases each year in the United States alone, mesothelioma cases are fewer than 3,000 annually. That small number means fewer people are affected, and it doesn't make headlines as often, so public awareness remains low. One big reason for this difference is how often each cancer occurs. Lung cancer develops inside the lung tissue itself and can be caused by smoking, environmental pollution, or genetic factors. Because smoking is so widespread, lung cancer gets a lot of focus in public health messages and research. Mesothelioma, on the other hand, develops in the lining of the lungs or other organs, called the mesothelium. It is almost always linked to asbestos exposure, which is a specific environmental hazard mostly related to certain workplaces or older buildings. Since asbestos exposure is less common and more specific, fewer people are at risk, making mesothelioma rarer and less familiar. Another factor is how these diseases are diagnosed and treated. Many doctors and hospitals focus on lung cancer because it happens more frequently. Doctors who specialize in lung diseases and cancers see many cases of lung cancer, but fewer encounter mesothelioma. Because mesothelioma is rare, patients often need to see specialists at specialized centers, which can limit general awareness and understanding among healthcare providers and the public. The location of the tumors also plays a role. Lung cancer tumors start inside the lung tissue, making them more straightforward to detect with common imaging tests. Mesothelioma tumors develop in the lining of organs, which can make symptoms less obvious early on. This difference affects how the diseases are studied and understood, contributing to mesothelioma's lower profile outside expert circles. Public health campaigns and research funding also focus more on lung cancer because of its high incidence. Media coverage, awareness programs, and funding are directed toward the more common disease. Mesothelioma, being rare, receives less attention, which means fewer people know about it or understand its causes and treatment options. In summary, mesothelioma's rarity, its strong but specific link to asbestos exposure, the need for specialized care, and the overwhelming focus on lung cancer because of its prevalence all contribute to why it is less known. From a lung health perspective, raising awareness about mesothelioma is important because it is a serious disease with unique causes and treatment needs. However, its rarity naturally limits its visibility compared to more common lung cancers. If you or someone you know has been exposed to asbestos or has symptoms like chest pain or shortness of breath, it is always best to consult a healthcare professional for personalized advice and proper diagnosis.